Good morning, everyone. My name is Mallory. I'm a biology major. I'm a pre-med student in college. I'll be a junior at UT. Hook 'em! Right now, I'm biological sciences, but once I can go into specifying, it'll be human biology because I prefer the human body much more over chemistry any day. Specialty-wise, I want to be an orthopedic surgeon. I've done a lot of shadowing in a lot of different specialties, but orthopedics has my heart for sure. So feel free to ask me any questions. Just DM me, snap me. I'm going to be on here all day, and I'll be giving y'all tips, anything y'all want to know. Coffee is also huge. I love it. Makes me stay awake, helps me study. Coffee is key. So I'll discuss the classes I took in high school. Obviously, it was 2 years ago, so I'm going to have to rack my brain. But medical microbiology, pathophysiology. I also took anatomy and physiology, which really helped me for the college anatomy and physiology. Physics, chemistry, AP English, history. And my favorite class was the health science practicum class. And if you passed that class with good grades, you were allowed to go into the shadowing class the next year. And luckily, I got to be a part of the shadowing class. And I spent 6 weeks shadowing in the OR, ER, cath lab. It was amazing. But to be in the OR, that rotation, I had to write an essay and get a little interview. So it was a select few. Only 2 people got in. So networking now, shadowing now, trying to just put yourself out there, volunteering. Anything you can do will definitely set you up better for the future. Like I told y'all before, I've been shadowing since junior year, and I continue to shadow the orthopedic surgeon. I did a lot this summer, and I'm going to add some more in August. I'm about to head out to work out, but when I get back, I will send in some pictures of things I've drawn for anatomy, my note-taking styles, things like that. So I played softball for 2 years, was a D1 softball scholarship, but now I decided to come back to Texas and just focus solely on getting into medical school. So my daily life for the last 2 years was completely different than a normal student. Being a college athlete is very time-consuming and demanding. I'm also a member of the National Society of Collegiate Scholars, great organization. If you have a high GPA, you'll get nominated usually in college. So my mom actually had a total knee replacement about a month ago, and her surgeon is who I actually shadow, and we're on our way to see him for her checkup. He's a very skilled surgeon. I trust my mother's life with him. Obviously, I've seen him operate many times, and he's definitely my mentor. He's helped me a lot. He does run a tight OR. Everyone's always thinking one step ahead, what tool to use and such, but he is very, he incorporates me, and he's a great teacher for sure. He always says the enemy of good is better. So in surgery, yes, you want to get something fixed to the point where it's the best it can be, but you also have to realize when to stop. You have to have that innate wisdom to know if I make this cut here on the retinaculum, is it actually going to make the patient's life better, or is there a chance it can make it worse? During surgery, yes, you still want to be smart and you don't want to take unnecessary risks, but sometimes you have to take a risk. Just understand the consequences and make sure it's an educated risk. For instance, in total knee replacements, if you got their range of motion completely back, everything's tracking fine, but one tiny little thing slightly off, leave it. You don't want to risk ruining it. But still, no, you want to still give every single patient your best. So you want to perform the best surgery, just know when enough is enough. So someone asked why I like ortho. I grew up an athlete, so I was always really familiar with the terminology and always excelled in anatomy and things like that. And I saw my first total knee and I loved it because it's like carpentry work of the body. It's awesome. And I love seeing how someone's quality of life, whether it just be walking or doing little things like that, can be greatly improved with joint replacements and stuff like that. with the man, the myth, the legend, Dr. Mitchell. What words do you have to tell us?
Every day, start your day with purpose and
Okay, so some people ask if I was ever squeamish. No, blood, bone stuff doesn't bother me, but it was surreal to see my first surgery. I was able to shadow through the health science practicum class. The hospital and the school just had a good relationship and they worked it out where students could go shadow after they passed the class. And once I did that, you start to build relationships with surgeons. And after high school, most of them said I could come back anytime. You just got to show them you're motivated. And also, some people ask how I take notes. I'm a very visual learner. Note cards, I make reviews, highlight, underline, all kinds of. A lot of times I'll bring the note cards, the reviews I make to work out, just walking the track or on the treadmill or something, and helps the information really stick. And when I say reviews, I mean like I'll take key terms and different things we go over in lecture, and then I'll make my own personal review for it. I like to write, not type. I like to write. But everyone's different. You got to find what works for you. Trial and error is going to happen. So you just had to figure out which way works best for you. For me, I take super in-depth notes in class. I like to write everything out, underline, highlight, and then I'll go back and I'll condense it in my note cards or reviews. And another way I found that helps me a lot is teaching other people. I would tutor my teammates or people in similar classes, and by explaining to them, I'd understand it. Usually for tests, I'd begin maybe a week or a little over a week in advance and start going over my notes. But after every single lecture, I'd go over the notes from that day. But like I said, you got to make it personalized for you. If you don't feel comfortable with the information, go to tutoring centers, go talk to your professor, engage with your professor. As for me personally, I've loved the OR. My shadowing experiences have been great. Sometimes it's intimidating, but never be afraid to ask questions. Also, after each procedure, I would always try to write new things down, describing the procedure I saw, key terms, things that can help me in the future. Another thing for studying, if you're on the go, Quizlet helps me a lot. I prefer handwriting the note cards, but if you just don't have time for that, like when I was on the bus, Quizlet helps. Class-wise in college, go to class. Sit front row, ask questions, be engaged. All these things sound cliche, but they really help me a lot. People are asking what's more important, good undergrad or good med school. You have to think of it as like a stepwise process. I'll explain. So you're going to want to go to a good undergrad that'll set you up and put you in a position where you can get into a good medical school. Once you get into med school, that's what's going to be important. That's what's going to count. When you're trying to get into a residency program, they're going to care more about med school, less about undergrad. But you still need to realize every step of the way counts. You want to do good in undergrad, you want to do good in medical school, and then want to do good in residency, and continue that trend every single day. But also realize, if you don't go to a prestigious Ivy League school, it's not a big deal. As long as you perform well in the classroom and you're working hard, you're going to get into med school. Another thing that can help set you apart when you're trying to apply for, medical school and stuff is doing undergraduate research. That's a great thing to do. So it's important to remember, when you're applying for medical school or PA school or anything like that, they want an individual who's well-rounded. When you're going to college and med school, realize there's always going to be people smarter than you, but you can control how hard you work. You just got to outwork your opponent. Piece of advice is, if something is making you uncomfortable, tackle that task head on. It's making you uncomfortable for a reason. Another person asked me to describe my favorite procedure. I've seen total knees the most, and I love those the most. I love them because I've seen them so many times, I'm starting to really understand the procedure step by step. But total knee revisions are awesome. Total knee replacement, the surgeon is going to put on different cutting blocks that are going to allow him to make cuts on the femur and the tibia. So as he's shaving away the osteoarthritic bone, he's doing so in a controlled manner because he has that cutting block on that tells him exactly where to make the cuts. So sometimes surgeons use guidelines such as Whiteside's line, and they mark it with a bovie pin, and this intersects with the transepicondylar axis, and it's used as a guideline. Note, there will be a meniscectomy made, meaning both the lateral and medial meniscus will be removed and be replaced with a polyethylene spacer. It acts as the meniscus. In some cases, the PCL will be removed. The difference between leaving it and not, usually there's not a huge difference, but if you leave it, you'll have a more normal feeling. In other cases, when the PCL are sacrificed, they are removed. These are in cases when the ligaments are far too tight or far too loose, they're hypermobile, they're not functioning. But when the PCL is sacrificed, the component's a little different. It has a transverse bar in the back that acts as the PCL. Normally, your PCL functions in a way that prevents posterior tibial subluxation. So once you remove it, you have to have that extra bar on the component to prevent that from happening. So next comes the tibia. After the surgeon checks the mechanical and anatomical axis, make sure everything's in a line, he's going to make his tibial cuts. Same thing, he just shaves away the bad part of the tibia. All of the bone fragments that are sawed off are measured, so that way the surgeon can get a feel for what size component he's going to want to use for the patient. So after the surgeon has made all of his cuts and removed everything, he'll put trial components on, test the range of motion, and see if he likes it. The surgeon will also check the patellar tracking. If it's tracking extremely laterally or medially, he'll do a retinacular release to allow that to track better alignment. Key terms, if your patient is really knock-kneed, they're called valgus, and if they're bow-legged, it's called varus. So if he likes the alignment and everything, range of motion's good, he'll take the trial components out, start getting the bone cement ready, put that in place, and put the official components on. You're good to go. And the bone cement's very interesting. It's not like a normal adhesive tape you would think. The bone cement actually grafts onto the bone, and it allows the component to grow onto that bone. That'll make his clothes, suture everything up, and it's super important that you suture properly and don't leave any long strands because your body harbors most of the bacteria that can cause infection. Clearly, I condensed that a lot. There are a lot more details that go into that pertaining to what size component, the degrees and everything, but basically that's a total knee. So one of the snaps didn't upload, but the posterior aspect of the patella will be sawed down as well, and a little component will be placed. Remember, your skin is your best friend. It helps fight off all kinds of infection. It is your first defense. It is a huge organ. Also, patients will have a little bit of numbness over the patella because one of the sensory nerve branches is indeed severed, and that's permanent, but it's not a big deal. It's just also, during the surgeries I watched and the surgeons I've observed, they've all have used tourniquets. It depends, but in the cases I've seen, it decreases blood loss.